Hello, my name is Delora Rushing, and I'm here to present to you my oral presentation for my technical communication class. My topic that I have proposed for you today is the proposal for decreasing the amount of needle sticks that's here in the U.S. Over the past decade, there has been an increasing number of total of needle sticks due to contaminated needles. In 2011, FDA have noticed that there have been disposed of 7.8 billion injections. Most of these injections have been contributed to people or patients that deal with diabetes, rheumatoid arthritis, HIV, and hepatitis. But the thing that comes to mind that we have to realize are, how are these things being disposed? Are they being disposed properly? So here's the problem. We need to figure out a way of how we could dispose these things properly that can cut down the possibility of other people being contaminated by this. Due to these high numbers, a lot of people today are being contaminated by needle sticks on the job. There was a study by J. Paul Lie that was entitled Characteristics of Persons and Jobs with Needle Sticks, and it totaled out to be the cost to pay back of all those different needle sticks came up to be $38 million. So what could we do with those $38 million? So here's my proposed, way to solve this problem. Maybe we could possibly make sure that each and every patient has had the opportunity to be distributed with proper sharps bin. I don't know if you've been familiar with it, but when you go to the doctors, you see the bins that are on the walls. Well, how about if we make sure that each patient that has to take some type of injection is given this opportunity to be able to properly dispose these things? It's several things that we could look at for me to make this proposal or process this proposal properly. Things that I have to take a look at are like, how would this impact the numbers? Will this cut back the number of needle sticks drastically? Or what would be the cost to issue the bins? Will the bins be cheaper than the payout of $38 billion, which I personally believe that will happen. My methods in solving this problem would be get in contact with the FDA, working closely with administrations, and seeing, what route would we have to take to make sure these things are distributed. I also would like to do different phone calls and surveys to different doctors' offices and ask them approximately how many needles they have estimated in the office. With that knowing, we can figure out how many bins that would possibly be needed. So my qualification for this is kind of funny that I chose a topic of this nature because I'm a diabetic myself, and I have been one for over 17 years. And I have seen the amount of needles that can contribute just from one person. So with me being able to parallel the fact of I've been using needles, and I always worry about the contamination or possibly being contaminated, someone else being contaminated by my needle, or better yet, if someone was to improperly dispose their needle, what is the risk factor that would cause me to be contaminated? There's definitely a need for this resource. With this resource, we can definitely cut down the number of needle sticks and contamination. So first steps first, we have to ask the government, the state government, to see what we can do. Because of California already has its state legislative that they're all disposed of, their needles has to be properly disposed, and everyone is given a properly disposed bin. So now it's time for us to regulate it here in Florida. How about we take the chance to give everybody the proper disposal bins so that the needle sticks count can be cut down? Thank you.